Hey, Dr. Walsh, it's good to see you again. Hey, we're putting together some information stuff for other veterinarians. You know, you've been using our products for a while now, but nobody's never heard of our stuff. I just want to ask you, like, what's the biggest challenges you and your patients and clients had or you're facing before you even discovered any Resona Health products?
The biggest problem we have, I run a rehab facility, and so my are very common to a lot of dogs, geriatric problems, to where you just can't get up and down like you used to, a little bit slower, kind of nondescript. Orthopedic problems, whether that be post-surgical or arthritis and that sort of thing. And then neurological problems. Those are kind of my three main ones. I do work on healthy dogs too, but they're usually like athletes. That's a little bit different type of training. But the first three were what I do the most.
So, what made you decide to even try the Vibe?
So I found PMF before. I want to say I've been using it for close to 5 years. And I realized through my research that I was um, getting better results from my combined therapies like laser and ice and massage and e-stim. Whenever I combine that with PMF, I got tremendously drastic better results. Plus, the dogs always seemed to be in better moods. They were more amiable, wanted to move around and do the things I wanted them to do. And so one of the devices that I was using um, is the company literally has been redesigning it. I don't know what that means, but I went to go order another one because mine had gotten old, and the company said we are trying to redesign this thing for almost 18 months. And I'm like, well, that's not really helping me because the one that I bought before was dead. Now I've got to go search. So I was out looking for new products that had PMF, and I am so glad I did because the one main advantage that the Vibe has that the other devices didn't have is that it has different settings. The other ones were a general, and that's what you see mostly in the market is it's an on off button or an app that goes turns it on and off, and maybe one or two settings of just general um, comfort or increased healing or something vague that you could kind of maybe some pain relief, if you will, but nothing really was specific. And I'm working on these animals from a different perspective than most folks would have at home. I'm working on this. I, I'm a veterinarian, so I'm scientifically going after the specific problems that they have. So I wanted something that I could dial into a particular situation. It's a difference between an old dog with arthritis and hip pain versus a young dog with anxiety. I wanted to be able to dial that in, and I found the Vibe, and man, I have to tell you, the results that I thought I was getting before is it's tremendously different. I mean, it is it is amazing to take an animal and you come in and this is their very first appointment. They're nervous, they've been in the car, they're all, excited. You put that vest on them and you slide that Vibe in there and you put it just on relax and balance or anxiety. And you just give them a few minutes, maybe even 5 minutes with that. Their attitude changes. They start licking their lips. A lot of times they'll lay down. They'll stop panting. They just look at you like, "Hey, we're cool. Everything's great," and I'm able to actually work on them.
Okay.
But
Yeah, it makes sense.
yeah, but when I also see this with my owners at home because I've got a number of owners that have purchased this dogs that were chronically high strung. I describe them as if on a scale of 1 to 10, if one is a German old German Shepherd laying on the porch on a Sunday afternoon, not bothering anybody, almost in a coma and 10 is a husky that's trying to rip the door frame out because you just left to go out to the grocery store. If some of these dogs, just like people, some people are high strung, some of these dogs live somewhere in the 7 to 8 to 9 range. So it doesn't take them much to get into panic state.
Right.
And to be able to provide something so that's safe, that's not going to hurt the animal, it's not going to hurt, you can't overdose them, you can't do any, there's no negative repercussions to it. To be able to provide that to an owner and go, okay, it's the summertime now. You know, thunderstorms are going to happen in our area here in the South. So go ahead about 2 o'clock. Go ahead and slide that vest on, and go ahead and get him in relax and balance. Go ahead and get him in a different state, and all of a sudden, their reluctance on or their dependence on drugs starts to drop. They're not having to take trazodone and fluoxetine and some of those other things that they were normally having to take just to stay in some sort of state of calm. So, I mean, it's not just that. It's a long answer to your question, but the whole point is the ability to change settings allows you to have a therapeutic advantage that no other device has.
That's awesome. So besides relax and balance and anxiety, and those are huge ones. What other protocols have you used? Just like one or two more that are common ones. Have you used wound healing much, for example?
Yeah, we have used wound healing. We use that a lot on our post-surgical patients, for sure. And I'll have to tell you a story that I used it on myself. And I know that it works on myself because I'm a runner, and I fell one day on the pavement and I really scratched. I mean, it took all the skin off the top of my knee. And I'm also a doctor, so I'm reluctant to go to doctors. And so I did not go get stitches like I should have gotten. And to this day, what used to be the size of a silver dollar, I worked with that PMF and having it on myself for about 7 to 10 days. And the only thing that's left on my knee right now is about the width of a dime, and it's one straight line, and no pain, no um, sensitivity to it, no nothing. So I know that it works for certain.
Okay, so cool. Well, that's awesome story. So we've got, you know this, but what we're trying to do at Rezona Health, because there's so many, our taglines are like an Apple Watch can tell you have AFib, but it can't do anything about it. A Fitbit can tell you slept like crap last night, but it can't make you sleep better tonight. An Aura Ring can tell you stress out, but it can't do anything about it. So what we're trying to do with our systems is have the complete solution, right? You can measure it and be able to treat them. And it's a health flywheel, right? It's a continuous process. So you get feedback. You can see with our carrier watches with the dogs, it's our mini tails for dogs and horses. So that is the biomarker. It's a GPS tracker, but it's also got heart rate variability, all this cool stuff that we can all see, as you know, on a NORAD control panel. We can see all our dogs and horses in our system and make AI real time 24 recommendations. You're looking at the data, I'm looking at the data. So mini tails, the tracker thing. What was your first reaction when you got it? I know we have an app that the consumer can see for your own dog cash. Just give me your first response to that technology when you first started playing with it.
You know, I think that there's always, for animals that can't speak for themselves, there's always this wonder. What exactly is your body trying to tell us? And we as veterinarians are trained in a number of ways to recognize some of those things. But even those things are guesstimations, the best that we know. To see real live data and be able to analyze that data without expensive cardiac monitors where you have to shave the skin and hold it on to them, and they have to wear it for a week, and then we have to send it off for diagnosis. That's commonly how we did things just a few years ago. And to see that technology has come along and it's real time, it's monitoring, and I'm able to see these things in this particular study, that we are able to see the variations, and we know, and the intelligence that is behind it is telling us patterns that we would have never been able to string together. And I know that it's been used in practice to detect chronic heart failure up to 3 or 4 months before we could detect it on a machine or blood work. And so what you spoke to as far as this group of systems is really huge, Mark. This is this is a game changer. Again, it is one thing to be able to track something. It is another thing to be able to affect it. But when you put those things together and you can actually make micro changes along the way, that's wellness.
Yes.
And just like the micro tweaks that we're learning when we have, like I've got one of these smart rings, I've got that, and I've used that before. Those little micro changes that you make it's kind of like keeping a car on the freeway in the middle of the road. It kind of drifts a little bit here or there, and you just make a little subtle adjustment. You're not having to do wild swings with the steering wheel. This is the exact same way. And for the first time, we're being able to do that in animals in a way that is not pharmacologically dependent. We've done that before with drugs, and I think we'll all admit that if we can have our animals and ourselves on as few prescriptions as possible, the better off everybody is. So I think
And,
it's a
and to
huge
wrap up
thing.
with just a couple more questions or comments is, and but our listeners don't, is like we're on the bleeding edge of creating new stuff, me and you. This is like crazy. So these are two things so far. We're early into it, but two stories of mine that I did not anticipate, of course, is unfortunately my best friend died in his recliner in March. He had a stroke and he had a puppy, right? And my wife goes, his name was Jumbo. Jumbo watched him die because he's a puppy and he's by his side the whole time. And I'm like, holy crap. And I went back and looked at his data, his heart rate, respiratory rate, all that stuff, but everything, all his vitals, all his stress stuff went through the roof. And then because we have a very accurate GPS system, I could see that he sat by the front door for 10 days waiting for his dad to come home. And you're like, holy crap. And then we had another one where we saw a person's dog stressed out over the weekend. And on Monday, they were fine again. And called them up and I'm like, did something happen to your dog on Saturday and Sunday? I'm like, no. But we did go away for the weekend and we have a brand new dog sitter. And it's like, so now that's one of those weird things is, oh, I don't want to get the dog sitter in trouble. Or was the dog stressed out because they didn't like the dog sitter, the new one? Or
Right.
is it just a new dog sitter that stressed them out? Right. So we're learning all these kinds of emotional things with this data, which is never anticipated. Right. And we're just getting started, especially with horses, the new study we have going there. So that's probably the last two questions. What was the most surprising thing, like story you might have, like I just did? And then what I want to close with is, what would you say to any veterinarians out there that have heard of PMF? Maybe they haven't, maybe they're skeptical and they should be. What would you say to them to try? So maybe just start with, do you have any stories like that
Sure.
surprised you first?
Yeah, I think the stories that we're hearing from owners are not only situational, they start off as situational. So what they notice is they notice that um, all of a sudden, um, let's say there's two dogs in the household, and this has happened in one of these cases. There's two dogs in the household. One dog was older, the other dog was younger. The older dog basically just tolerated the other one. I'll hang out. I'm not going to play with you. I'm going to snap at you if you start to get too rough and rowdy around me. I'm going to be over here on my bed. Leave me alone. Doing settings like inflammation, general inflammation, and helping mitigate some of that pain. The owners start to see that there seemed to be a little bit more interaction. That's how it started. But within, I want to say a week to 10 days, all of a sudden that dog that used to be sitting over there is now, when the leashes come out, it's charging towards the door. We didn't change the age, but
Right.
we improved the quality of life. See, what we don't realize, Mark, because we're limited to our human senses, is that dogs, not only their noses pick up over 60,000 smells, their ears can hear over a mile away. Um, they are incredibly dexterous with their feet and being able to roll and move and place their paws properly. but they also pick up on energy. And I will tell you this is not taught in vet school. And I didn't believe it until I actually saw it. PMF, I tried it when I first started rehab on a lark. I just like, all right, we'll
Okay.
see. You can't see it. There's no buzzing. There's no heat. And there's no immediate effect in a lot of cases because it's not like a light bulb. But if you pay attention, the animal does say things to you.
Right.
And that's something that the skeptics, and I would have had a hard time grasping with this in general practice. And the reason is in general practice, think about your trip to the vet. It's chaotic. There's 13 other dogs sitting in there. Everybody's barking and milling around, and everybody's anxious from being in the car and being in the vet smell and the whole deal. They come in, the vet has maybe 15 minutes to talk to you, and they've got to make decisions. We've got to go over the history and blah, 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 blah. We got to move. I, Even my observation skills are limited at that point, even with my training. But to be able to see the dog sit down, relax, look at you, kind of, wait a minute, there's something else going on here. And so what I would tell folks to do is if I was telling colleagues, and I do across different conferences, I'm going to Nashville in just a couple of weeks to speak. I tell colleagues, listen, try it. Try it on your most anxious dog. But most importantly, try it in a controlled setting. Try it at your own house. Put it on. You're not gonna hurt the animal. See what happens and just be observant. Just be quiet and just observe, and you're going to see those reactions. That sort of thing is, it starts off small, but it gains a huge head of steam, especially when we're able to make micro changes along the way, adjust that protocol along the way. And that's what this system is all about. And so I guess if I had to really tell veterinarians where to go, I'd say, listen, the device that has the most settings, that's what we want in our clinics because we can specifically nail it down to a particular setting. The the ease of use is another thing that is it's designed like an old school iPod, and so it's intuitive to be able to use. But we haven't even talked about the one of the major things, and your design of having the vest to where it goes on the dog and it sits in that vagal nerve complex, which is the second largest nerve center in the body behind the brainstem. That is the difference between night and day. On the other devices that I had previously before having the Vibe, it was a bed that they were on, which was fine as long as they were on the bed, or a little disc. And then there's also a very popular one in the vet world that's a loop that goes over their neck, like, and they wear it like a necklace. All of those are fine and effective. Um, but none of them could I change the setting on. None of them could I fine tune anything. It was kind of I hope this is helping kind of attitude. And when I started seeing the results that it was helping, I started to believe in PMF. So I started off as a skeptic too. I'm first to admit it. But I would say start small, start on your own animals at home. Heck, put it on yourself. See if you
Right.
don't feel better after a long day and put on relax and balance and sit down in the chair and see what happens in 10 minutes. You're like, wait a minute, today didn't suck so bad after all.
Yeah. And you have the of course we have the bandanas too and the vest, but it's therapy on the go. So they're not laying on a mat. They can be playing ball, walking, doing what you normally do with your dog outside, having fun, and they're getting therapy while they're doing it. So, hey,
Yep.
thank you so much. That was super insightful. I really appreciate it. Hopefully that helps a lot of people that aren't familiar with any veterinarians out there. Like you said, give it a try. We have money back guarantees. If it doesn't work for people, we don't want you to pay for it and not keep the device, and we'll send it back to us. So, thank you again
That's
for your
right.
time.
Well, for sure. I know it's helping 30 dogs a day here at my practice, and I wouldn't practice rehab without it. That's for sure.
Thank you so much for your time.
All right.